I'm so excited for our next guest because we're going to talk about one of my favorite things, bonding dentists together. So I have the awesome Dr. Lisa Wong here, who's making me jealous already from where she is sitting. Lisa, where are you sitting? Oh, you might just have yourself on mute. She might be muted. Lisa is in Hawaii.
Here we go.
Yeah, perfect. So really rub it in. Look at Morgan Bellis. My team member went to San Diego. Haha, Hawaii is better than San Diego, Morgan Bellis. So take that. Thanks, Lisa. So tell us where you're in Hawaii. Tell us who you are, where you're working, and why you're looking for an associate.
All right. I am Dr. Lisa Wong from Honolulu, Hawaii at Hawaii Dental Clinic. Can you hear me okay?
Yeah, we're great.
Yeah, okay, great. We have 10 locations total, so we've grown quite a bit, and we are looking for associates right now in Hawaii.
Awesome.
We feel that family is very important. That's kind of our core culture.
Cool.
So we'd like to extend that culture to our Hawaii Dental Clinic community. So we do have a ohana at work as well.
Nice. And listen, I understand when you live in Hawaii, you can't just be on vacation all the time. When I go and speak and they say, oh, Paul, you're going to Scottsdale, Arizona. What fun did you do? I'm like, I don't know, stayed in the hotel and had to work the whole time. So I want you to bring to life a little bit that being in Hawaii is awesome, I'm sure. But, you know, this is where you have your career. How did you get to Hawaii? Is this where you're from? And why would somebody want, gotcha, that's awesome. And why would somebody want to consider outside of the movie part, outside of the vacation part, your culture and your practice? Why would you want this job? Don't speak to somebody who necessarily is from there thinking, I could go anywhere in any of the states. I might pick Hawaii with Dr. Lisa. Why would you pick this job if you were applying?
Why would you pick it? Because we have awesome people. We have a great team. We have many opportunities and options, depending if you are a BAD or MAD.
I like that. Thanks.
So if you are coming right out of dental school, we do have CE courses for you. We also have relocation packages right now.
Oh, nice.
I understand that it can be
highlight that
a lot of effort to get here.
That is a great topic. And you also, I love that you mentioned Nacho language. BAD stands for baby age dentist, not baby age human. Just if you're 0 to 2 years out of school, we classify as a baby age dentist, which I think you should love because everybody likes a baby. I got a 3-year-old. Once they start getting 3 or 4, no one likes them as much as when they're a baby. One of my team members is a baby. A medium age dentist like us, which stands for MAD. So I think that's a really great reason. What's the dental? I'm curious. What's the dental community like in Hawaii? Are you guys all part of the same study club? Is it a strong dental community? I'm actually just totally curious because I like to learn about others.
Yeah, that is common. There are a bunch of study clubs that we can join.
Nice.
But we also inside of our group we have opportunities for CE where we can get together and study together, learn. I'm planning a actual course for implants soon with an implant company that I'm really excited about. So that'll be fun. It'll be like back in school. We're all together, studying together, placing implants together.
One of the things you shared in the beginning is you want to build a team that has your back. And when you're a dentist, having other dentists on your team that you can ask questions to, is this normal? This patient won't open. They won't open for me. This patient's annoyed. They're annoyed for me. It just makes you feel less alone. And it doesn't, I have 2 locations, Lisa, and sometimes it's through a text message. Sometimes it's through a FaceTime. Sometimes through a phone call. But when you can pick up your phone and talk to a dentist on your team, especially one who's more seasoned than you. But I learned from our associates, it really feels like you're part of something. And I think dentistry just needs more of that feeling because when you just feel isolated. So I think it's just awesome. How many dentists you guys have right now working together?
So we have 10 dentists right now. We have 3 managing dentists, and then that includes myself. And, if you're ever in the op by yourself, in the dental office by yourself, you got a shady patient in front of you, you can always give me a call. I can assess the situation and help as much as I can. That's really what my job is. That's what I'm about, is to make sure my dentists are happy. They have everything they need, and they have the confidence that they need to do their job to provide care to our patients.
Yeah, but I really appreciate being part of our Dentist Job Connect program. We're so proud of what we're trying to do to bond dentists together. One of the things I'll encourage you to do, because you have such a great personality, I'm a big fan of this guy, Gary Vee, and talks about taking videos. Take videos in your dental office. Don't violate HIPAA. I'm afraid of that. I don't even visit the hippos at the zoo. Not worth it. But take videos in your dental office when you guys are there and just post them on Dental Nachos with your ad attached to it. Go ahead and do that. You will be amazed at how just a 30-second video that's not fancy saying, hey, this is Dr. Lisa, I'm here with Dr. Joe, and we're going to talk about our implant course. That really brings you guys to life. I call it BTL because, as dentists, we're a little bit weird, right? We always think people are out to get us. Someone's going to scam us. Someone gives us something free. We say, what's wrong with it? We get all twisted in dental school. But when you can do, so make some 30-second videos, anyone on dentist job of fun. If it's patients in it, get HIPAA consent. I'm not here to talk about HIPAA, but it could just be when no patients are around. Because I think when dentists see, so you want to buy a home you can see inside of, everybody clicks on all the pictures, right? When they want to rent a place. Do that for your dental office, Dr. Lisa. I think it'd be amazing. Some videos, some pictures. I think you can do it.
All right. That'll be fun. So guess what?
What?
Dr. Nacho. Guess what I have for Dr. Nacho, Mrs. Nacho, and the whole Nacho verse?
A free trip to Hawaii? That's so nice. I'm leaving. What do you have for us?
It's close. I found a recipe for Hawaiian nachos.
Oh, wow. I want to hear about it. That's great. We'll have it tonight.
See?
Yeah, I want to see.
I have for you. Unfortunately, you can't eat it, but you can pretend.
Oh, that is impressive. Take a screenshot of that. Hold on. I want to see if I can pull back for a second so I can see this better. Oh, yeah. Awesome. Get a screenshot. That is impressive. What's on it, Lisa?
Okay. So we have your standard nachos, and then we have Kahlua Pork, which is a traditional Hawaiian dish. Do you know what that is? It's basically you dig a big hole in the ground. Traditionally, you would dig a big hole in the ground, and you put the whole pig inside, and you smoke it for hours and hours. Well, nowadays we can use a slow cooker, or if you're busy like me, you go to the grocery store and just get it there. And then we also have lomi lomi salmon, which is made out of diced tomatoes and salmon. And lomi lomi means to kind of massage, so that's how we kind of mix it all up. Then I have sour cream, cheese, of course, avocado.
That is a true masterpiece. Like the movie Encanto, that is a true masterpiece, Lisa. Who's going to get, at least tell me this, since I can't, who's going to get to eat that now?
Well, a dentist will get to eat it. This is the Kahlua pig and the lomi lomi salmon. So
you're a nice boss. Now this is what happens to me is I see this and now I'm going to have to go get nachos at Alves tonight on that. That's so great. I love that you did that. You brought so much fun to it. You look awesome. Thanks so much for being here, Dr. Lisa. I hope you come to Philly and visit us in person one of these years.
Oh, yeah. That'll be fun.
You guys should take the whole team and travel around and try to convince people to move to Hawaii. That's what you could do, Come to Philly and, come to Philly when it's cold and be like, you feel cold? It's never cold in Hawaii, right? Really rub it in on us. Awesome, Dr. Lisa. Thanks so much. To get connected with your job, you can text Hawaii to 215-543-6454. But what is the practice website if people want to check it out?
So it's www.hawaiidentalclinic.com.
Awesome. We'll put that in the comments. Well, thanks for being so fun and fantastic, Dr. Lisa. We really appreciate it.
Thanks so much. Mahalo.
So as you guys can see, a super fun show. I want to share one more time our molar endo C thing. This is what we strive to do. Take helping people seriously, but we don't have to take ourselves so seriously. Awesome guest on the show today. Have an awesome day, and please join us for our molar endo C course by just texting molar to 215-543-6454.